Erin with this week's health and nutrition news. Is counting calories really the key to losing weight? Nope. It's better to lose calories from exercise than just watching what you eat. Keeping our bodies in tip-top shape often involves a well-balanced diet and regular physical activity. While there's a common belief that we need to burn about 2,000 calories a week, recent research shows we should focus more on the time spent working out rather than the number of calories burned. Experts say that 30 minutes a day spent biking or power walking is good enough to keep us healthy. If that sounds too intense for you, a recent study found that you can divide these 30 minutes into 12-minute chunks throughout the day. Since pushing our bodies too hard may cause damage to our hearts, trying to burn 2,000 calories a week can actually be dangerous. So keep your food and exercise habits down to bite-sized chunks. Too much sleeping and sitting is as bad as smoking cigarettes. A study found after examining the habits of over 230,000 people. Researchers found that people who spend most of the day sitting and sleeping too much may be as likely to have a shorter lifespan as people who smoke too much. In fact, the people who were not physically active were 1.6 times more likely to live a shorter life than those who were physically active. What does physically active mean? The study defined it as more than 150 minutes of moderate to vigorous physical activity every week. And when people combined physical activity with long sleep times and extended periods of sitting, the negative effects were even more dramatic, with 4 times the risk of having an otherwise full life cut short.
1, 2, hey you, get off that couch, do dips.
It may be late fall, but there's not much flu going around in the United States so far this season, according to a new report from the Centers for Disease Control and Prevention. Between October 4th and November 28th, the percentage of people visiting the doctor who were there because of a flu-like illness was just 1.9%, which is slightly lower than the percent usually seen in the off-season or the summer months. And during the last week of November, 44 states reported minimal flu activity, while just 2 states, Oklahoma and South Carolina, reported increased or moderate flu activity. No states reported high flu activity. Last year, flu activity started to rise in late November and peaked in December. But because flu activity has remained low so far this season, there's still a large benefit to getting a flu shot if you haven't done so already. After all, do you really want a runny nose, coughing, and a sore throat making the holidays miserable? Be careful with hot beverages, sharp decorations, falling Christmas trees, and fiery menorahs, because the holidays bring unique health dangers. Otherwise, you might be saying, ho ho ho, whoa, I'm slipping on ice. If hot beverages are left close to the edge of a counter or table, hot chocolate or tea can end up falling over and burning folks. Keep hot drinks far back from the table edge. Watch out for ornaments too, which can present choking hazards to little baby relatives or poke your feet if you're running around without shoes. Garlands and strings of lights can trip you up or pull your arm in wacky directions. And Christmas trees can light on fire if they're too close to heaters or have faulty lights on them. Check live trees for freshness and water them generously to prevent them from drying out, or they might be dry enough to burn. Menorahs present another risk because of lit candles. The National Fire Protection Association recommends keeping flames at 12 inches away from anything that can burn. Use a sturdy holder and never leave burning candles unattended. And fireplaces? Well, a roaring fire on a cold night may be cozy, but health experts see a spike in cases of burns on the palms of children's hands around the holidays from the hot glass doors on fireplaces. So, while you're enjoying the holidays, make sure to play it safe too.